Good morning, all. That's a good beginning. It is a beautiful day and a beautiful fall day in Washington, so a wonderful day to be here to be with the Building the Case for Health Literacy workshop for the Roundtable on Health Literacy. I'm Bernie Rosof, chair of the Roundtable on Health Literacy of the National Academy of Science, Engineering, and Medicine, and I really want to welcome everybody to this morning's meeting. Just I want to let everybody know that this meeting is being recorded and videotaped for webcast across the internet, just for everybody's information. The mission of the Roundtable on Health Literacy is really to inspire, to activate a wide variety of stakeholders to develop, to implement, and share evidence-based health literacy practices and policies, with the goal of improving the health and well-being of all people. And I think that we'll point out today that a health literate population is really necessary to achieve the quadruple aim. As one of its major activities, the Roundtable sponsors workshops for members and the public to discuss issues of importance and concern, such as the focus of today's workshop, and that is building the case for health literacy. Indeed, if we had to build a case for health literacy, today will be the discussion about that. As you are aware, the field of health literacy has evolved from early efforts which focused on individuals to one in which recognizes that health literacy is multidimensional. Health literacy includes both system demands and system complexities, as well as individual skills and activities and abilities. While communicating in a health literate manner is important for everyone, you can imagine that it is especially important for those with limited health literacy who also experience more serious medication errors, higher rates of hospitalization and use of the emergency room, poorer health outcomes, and obviously increased mortality. And to negotiate a health literacy and social determinants of health is really an issue that we will discuss again today. Over the past decade, research has shown that health literacy interventions can significantly impact various areas, including healthcare costs, outcomes, and health disparities. It also has been noted that health literacy is key to delivering high-quality, person-centered care, health services, and programs, both on the medical care system and for public health. Critical that health literacy is considered when we're talking about person-centered care, family, and person involvement. To understand the extent to which health literacy has shown to be effective, the Roundtable on Health Literacy commissioned a paper that would identify and describe peer-reviewed evidence of the impact of health literacy in a variety of areas and contribute to achieving the quadruple aim. And that quadruple aim really is a framework for better care. And we'll get into that significantly as the day goes on. And obviously, what we do then is improve the health of the communities, provide better care, and provide affordable care. And by the way, we added the fourth dimension to the usual triple aim, quadruple aim, to improve the experience of the healthcare team, to avoid burnout, and be responsible to the healthcare team as well as others. On the agenda today, you will note that we will participate in an important and informative workshop on building the case for health literacy. The Roundtable has been working for a while in building the case for health literacy. This will just put it into a better perspective, or a perspective. I want to thank the members of the Workshop Planning Committee who organized the workshop. They are Susan Backrath, Lori Hall, Stanton Hudson, Lori Myers, Lori Noonan, Audrey Riffenberg, and I also served on the Planning Committee. As always, I will ask the Roundtable members to be thinking carefully as the day goes on to consider key points that were made during the meeting. Because at the end of the meeting, as we usually do, I'd like each one of the Roundtable members to highlight their thoughts, a couple of interesting points, a couple of sentences about important points made during the meeting. Helpful as we begin to think about the contributions of the meeting and how we look upon next steps related to the Roundtable. Before we begin, I want to ask each panel and speaker to please try to stay within the time allotted so that all may have an opportunity to share their knowledge and we'll have an adequate time for Q&A. Melissa, where is Melissa? Oh, she's right there. So Melissa will hold up cards with time frame, 5 minutes, 2 minutes, and 0 minutes left on your time to be up here at the podium, so you'll know when your session is drawing to a close. So Melissa will be quite available to us. So we sometimes become so caught up in health literacy research or our intervention design work that we fail to recognize or even remember what got us here in the first place. We wanted to begin today's workshop with a panel which will remind all of us why we're so committed and passionate about the importance of health literacy. So we will hear from this morning, two patients who experienced major challenges when interacting with the healthcare system. And by the way, I appreciate both of you being here this morning, so thank you. I'll briefly introduce all panelists first. And by the way, longer bio sketches for all our speakers are available in the handouts. Each will make his or her 20-minute presentation, so please hold questions until all have finished, and we'll have plenty of time for discussion, both by roundtable members and those from the audience outside the roundtable. Let me first introduce Mr. Martin Radarman. He's a craftsman from Central Missouri. Already told me it was a long ride to get here. With roots in St. Louis. He started in the carpenter trade in 1973 and began Radarman woodworking in 1981. He has done residential cabinetry, high-end architectural woodwork, and numerous liturgical commissions. He has also built fine, handcrafted furniture. We can really use you up in the Northeast, Martin. So, Martin is a cancer survivor. He speaks publicly to medical schools, healthcare providers, and advocates for patient safety and avoidance of medical errors. Ms. Jennifer Pierce is a passionate advocate for patient engagement through understanding. She began her journey as a patient who suffered due to poor communication and then moved on to found Pain Language Health, a consultancy specializing in co-producing content and care experiences that patients can easily understand and act on. Plain Language Health has been an important advocate for health literacy.